With over 1 million members, we know what people can do when they come together. We are Rotary. We are people of action. Find out more at rotary.org/action.
Good afternoon. Welcome to a special live presentation of Rotary District 6150. We hope everyone is staying safe and healthy. I'm Hatton Weeks, a member of the Rotary Club of Jonesboro. I'll be your host and moderator. Thanks for joining us either on Facebook or YouTube this afternoon. At the end of this presentation, we'll be taking your questions, so please ask questions in the chat window on the live feed. Also, please take a moment and like the Rotary District 6150 Facebook page and subscribe to the District 6150 YouTube channel. Now I'd like to introduce our Rotary District 6150 Governor. George is a member of the Rotary Club of Lawrence County. He's now retired, but spent a career leading hospitals and medical facilities across our district footprint. Today's virtual meeting is his idea as we look to stay connected and stay informed. Rotarians, please welcome 6150 District Governor George Fray. George?
Thanks, Hatton, for the introduction. And I want to thank you for being here today and a part of this special Rotary District 6150 webinar. My name is George Fray, your district governor, and our presenter today is Dr. Jennifer Dillaha, state epidemiologist with the Arkansas Dept of Health. She is a fellow Rotarian and a member of the West Little Rock Club. But I want to pause and share with you that we will have a virtual district conference this year. It will be conducted on Saturday, June the 27th. It will start at approximately 10 a.m. We will break at 12 for lunch and resume at 1, and we should finish by 2:30. We are excited for several reasons. One being that it will be a celebration. Second, it will present the opportunity for more Rotarians to attend a district conference than ever before without leaving their homes. So please mark your calendar. Dr. Dillaha is a fellow Rotarian, a member of the West Little Rock Club. She became a Rotarian in April 2011 and has come to understand what Rotary means to her personally and professionally. And she is here to share with us an issue that she has become deeply involved in. Dr. Dillaha has worked at the Department of Health since 2001. Where she has played several roles over the years. In March 2020, Dr. Dillaha was named the state epidemiologist for Arkansas. This, in addition to her role as medical director for immunizations since November 2013, and the medical director for outbreak response since August 2019. Her charge in the role of state epidemiologist is to provide leadership and guidance for addressing Arkansas's most pressing infectious diseases, including COVID-19. She is also charged with improving Arkansas's immunization rates, particularly among adults. She is uniquely qualified for that role as a physician with specialty training in internal medicine and subspecialty training in infectious diseases and in geriatric medicine. Her topic today will be an update on the COVID-19 pandemic and what it means to Rotarians in Arkansas. Please join me in welcoming Dr. Jennifer Dillaha.
Well, thank you, George, and thank you all for joining us today for this update. I wanted to start by telling you how important being a Rotarian has been for me over the past several weeks. You know, the work I'm doing now is tiresome and there's a lot of stress. I feel like I'm working to keep a train on the track and it's a long train ride. And my fellow Rotarians have been a tremendous support for me during this time. I can't tell you how often I've received an email or a card or a postcard or a note or a post on Facebook, so many things of people encouraging me and supporting me in this effort. And I'm just so grateful. And so I'm very happy to be able to provide this update for you all. As I mentioned, this is a moving train. Every day is different and things don't stay the same. So I wanted to give a little bit of an update with some numbers. So I'm going to try to share my screen right now so that you can see what we have on our health department website. There we go. So we've changed a little bit about what we do in the health department in terms of how we report the information and the data. So you can see that in the upper left-hand corner, we have well over 6,000 cases total since the beginning of the pandemic. Right now, we have over 1,700 cases who are cases right now, and we've had 4,400 people recover and already 120 deaths. On this website, you can see the counties, and the counties with the darker colors are the ones with the higher number of cases. We have only one county where you can see that we have no cases so far. I don't think that will stay that way, but you can see. So here we are, Pulaski County. If you get on the map and you click on it, you will see that every county has some information about it. You can tell the total number of positive cases, active cases, how many deaths, how many have recovered, and the total number of negative tests. So that gives you an idea that if you have a lot of tests and few cases, then you may not have a lot of spread in the community. But if you don't have very many negatives, or meaning number of tests, and a lot of positives, you might think that in that county there'd be more cases. So this is a resource to you all here in Rotary so that you can check on your own county. So let's think about some of the counties we're looking at. We could look at, let's see, what would be a good county? Grant County. And you pop on the county and it will tell you, show you where it is and what's the case too. What are the rates, not the rates, but the numbers of cases. Then we have a large number of tabs that you can see that change and show you different things. These are where the active cases are. And there are some counties that don't have active cases right now. You can see where the deaths have been. And these are deaths by where people reside, not the hospital where they die or something like that. And it tells you what kind. Here we have deaths related to nursing homes, deaths related to correctional facilities. And then here's some information about the age groups. It will tell you something about that. And then by race. And then we only have one ethnicity listed, which is Hispanic. We have number of tests, so you can see where a lot of testing has been done. There's other health metrics you can look at. You can see what the demographics of the cases are, and then you can see where we are with the rest of the U.S. And around the globe. We've had almost 2,500,000 cases around the globe. So I'm going to stop sharing now and make a few comments, and then we'll start just letting people ask questions. So what we're seeing in Arkansas, of course, is an increase in the number of cases as we've opened up. And we've had a lot of discussion about what that means for us in Arkansas. We have greatly increased the capacity for testing in our state. And I'm very happy to report that many of the health departments, local health units around the state are now providing testing for COVID-19. And it's to anyone who wants to be tested, whether they have symptoms or not, whether they are a contact or not. So people may go to a local health unit. They should call ahead and make an appointment. And and there will be no charge to them. If they have insurance, we would love to be able to bill to recoup some of our costs, but it's not required in order to be able to get a test. So this will be a good resource for us in Arkansas. There's a number of places around the state that have sites, testing sites where people can either drive through or come by and get tested. They don't have to be a patient there, for example. Some pharmacies and clinics have set up places for people to go and get tested. And on our health department's website, if you go to healthy.arkansas.gov and you go to the COVID-19 webpage, you'll be able to find a map that lists where all these testing sites are and a little bit of information about them, when they test and what the hours are and so forth. And that's a very good resource for people around the state. So as testing has increased, of course, we're finding more cases. And I think that is a combination of improved testing, but I do think that in some locations we are seeing increased community spread. Of course, in the beginning, we began to see spread in congregational settings or congregate living settings, you might say. So nursing homes as well as correctional facilities. Those situations will continue to come up from time to time, but we now have a process in place for those, a really good strategy that seems to work to minimize the spread when cases occur in those settings, as well as to make sure that people stay safe, especially in our nursing homes, because sometimes if the healthcare providers, the nursing aides and so forth are sick, then it's a strain to be able to provide the care that nursing home residents need. So we've worked out a process for how to manage that, and it seems to be working very well right now. So what we're seeing in terms of community spread are a couple of things. One is we're seeing spread in communities around the state, such as the counties near Memphis. Memphis is having a large number of cases, and many people go to Memphis for work or for healthcare. And so people are being exposed and then coming back home to their counties near Memphis, and they're counted as cases there. We also are seeing cases in manufacturing facilities and poultry plants. And this occurs when people are in close proximity to one another. And there, some businesses may have policies in place that discourage people from missing work if they're sick. So sick employees may come to work and then spread the illness to others because of the close proximity. You know, sometimes they work elbow to elbow. So the health department has been working with manufacturers and the food processing companies to change their physical layout, their assembly lines, and working with them to make sure that their sick employees are able to stay home, and those that have been exposed, if they're needed to keep going, then they're cohorted in such a way that they don't expose other employees during their quarantine period in case they get become ill with the disease. So let me just talk a little bit about contact tracing. So of course, when a person receives a positive test, meaning they have the virus present for COVID-19, that result is reported to the health department, and that person is assigned to a nurse at the health department who gives them a call, interviews them to learn about when their symptoms began. Sometimes people don't have symptoms, they just get the test because of other reasons. Maybe they were exposed to someone, but either they learn when their positive test was or when their symptoms began, and then they back up 2 days And that is the beginning of their infectious period. And they're interviewed about where they have been, who's in their household, were they working, where did they go, did they spend time with other people outside of work or outside the home. And they're provided with instructions about how to properly isolate so they don't expose others, and then about what to do if their symptoms get worse and they need to go to the doctor or to the hospital. Then sometimes we'll have a second person call the case and get a list from them about all those people that would have been exposed to them, that would have been close contacts. And we define a close contact as someone who has been within 6 feet for more than 15 minutes. And we try to identify all the close contacts and follow up with them, give them instructions about how to properly quarantine. Quarantine is for 14 days because what you want to do is stay out of the public so you're not exposing people during those 14 days in case you do develop the illness. Sometimes people will be able to pass that virus for a couple of days before they develop symptoms. So it's not going to be possible for people to predict when they need to be out of the public. So we require people to quarantine for 14 days. When a new contact is identified after a case is found, we try to get them tested right away in case they are already an asymptomatic case. But if they have a negative case, they still need to quarantine for 14 days because it could be a false negative. They could develop illness later into their quarantine period. But if they go through the whole 14 days without any symptoms, then there are any positive tests, then they're free to go about their business. People who are cases, if they are able to stay well enough to stay at home, they don't need to go to the doctor for any reason, or they don't need to be in the hospital, then those people can be isolated for 10 days. We have found that, or the CDC has found through studies that they're not able to isolate virus that can be cultured from people after 9 days of symptom onset. So we count 10 days, and that's when they can come off isolation. Now, sometimes people after that 10-day period, for some reason, one or another, may get another PCR test or test for COVID-19 and it's still positive. But it's thought those are residual virus particles that are not viable. So we really discourage people from getting a follow-up test to see if they have cleared the virus. But we go by the CDC recommendations for isolation for 10 days, and then they can go about their business. And then the final thing I wanted to say is it's getting to be very popular, I guess you could say, for people to get antibody tests for COVID-19. And I would discourage people from doing that. The reason is that an antibody test is not useful in making clinical decisions. An antibody test tells whether someone has antibodies to whatever they're testing for, in this case, to COVID-19. It takes a couple of weeks to develop them, so people don't have a positive test till they're already getting well after having COVID-19. So it's not useful to have these tests to diagnose a case. And by that time, that person has been out and about and they have already exposed people. So we really need the PCR test to diagnose a case. And then some people say, well, you know, I had a respiratory illness in January. I wonder if I could have had COVID-19 back then, and they get a test. And the problem is that many of the antibody tests do not distinguish between COVID-19 and other coronaviruses that cause the common cold. And these tests have been approved under emergency use authorization by the FDA, but they haven't gone through studies to validate them to make sure that they really test what they say they have been testing. So if it's negative, you can't really be sure if it's a true negative, and it's positive, you can't really be sure if it's a true positive. So they're not really useful right now, but I think that, companies are just making money off of these. And so I encourage people not to use those tests. One of the problems we're encountering is that some healthcare providers get mixed up about what these tests means. There have been reported to us that people with a positive PCR test and a negative antibody test are told they don't have COVID-19, and that is absolutely incorrect, because a person in the beginning of illness will have a positive PCR test and not yet have developed antibodies. When they develop antibodies, that's when the symptoms go down because they're convalescing. So that's an inaccurate guidance that healthcare providers have been giving. And so I just wanted to mention that and let people know that there is some confusion out there. And of course, if you're a Rotarian and you want to give me a call, you are welcome to contact me at any time. So I'm going to stop now and try to answer questions that you may have.
All right, we're being joined by fellow Rotarian, Dr. Jennifer Dillaha, the Arkansas State Epidemiologist, infectious disease specialist with the State of Arkansas Department of Health. Taking your questions. So if you have a question, be sure to ask in the chat window, either on Facebook Live or YouTube. A lot of questions are going around on the chat window about doing summer activities. Now that we're into that, I'm going to kind of dig into that in a moment. First, as we get into the summer, I've been hearing about a second surge in the state. Is it because of the testing, and what data are you looking at? And are we looking at a ripple or a tsunami as we head into a second wave or second peak?
Okay. Well, there's a couple of things going on here. One is, we're beginning to open up and lessen the restrictions that we have in our state for COVID-19. Excuse me just one moment. And many people have taken that to mean that precautions such as physical distancing, wearing a cloth face covering, or cleaning one's hands often are no longer necessary. And actually, it's the opposite. These steps are more important than ever, because people are now out and about and mixing in ways that they hadn't before the limitations were lifted. So we strongly encourage people to wear a cloth face covering. This is to prevent someone from spreading the disease to other people when they don't know they have it. And you cannot tell by looking at someone whether they have the virus or not, unfortunately. And it seems that asymptomatic spread is playing a bigger role than was previously thought. So we do encourage that. So that's one issue going on with summer and the lessening of activities. The other thing that is happening is now people want to go back to what they would have normally or routinely done in the summertime. And that's really problematic, because we're in the middle of a pandemic and we cannot go back to the way things were before, and we're going to have to use caution. So it has been a balance between lessening the limitations and then giving guidance as to what people should be allowed to do, and what's reinforced, what is reinforceable. So the Secretary of Health, in collaboration with the governor, has issued directives, and directives should carry the weight of law. And the guidances are recommendations of what we should do, but they're not intended to be enforced. So we have a number of documents on our website that can help guide people. So this is a kind of a delicate balance between what we tell people they must do and what we tell people they should do. And just because they may do something doesn't mean they ought to do something. So one of the issues is like opening up of churches, So we put guidance out there as to if the church is going to open up, this is the safest way to do it that we can guide you in. But that doesn't mean that churches have to do it or should do it. That needs to be their decision. So when it comes to other activities such as sports or children's activities, I would encourage Rotarians and their families to be very conservative about what they do, that they should stay away from crowds. And if that means not going to a swimming pool that's crowded and not following the guidance and directives given by the health department, people should remove themselves from the situation. Same thing with going to a restaurant. We've put directives into place for how things should work and be done. But if it's not being done that way, I encourage you to remove yourself and your family from that situation. And I think this is a time for people to continue to stay at home for as much as possible and to do family related activities as much as possible, and to it's easy for me to say because I'm an introvert, but my son is an extrovert. He wants to get out and see and be around people. So I think it's going to be people having to weigh those options for themselves and still protect themselves and their family. So I'll stop there.
And just to further your comment, we are lifting some restrictions, and some people will hear that as it's over. And
Right.
That's not the case. It's you may, but should you?
Yes.
And you mentioned, crowded swimming pools, and we're beginning to get some questions in on summer activities. Here's one from Rayanne Fields. I assume there's some guidance online about summer camps, but asking
Yes.
for any guidance on camps.
Yes, so we did put out some information for summer day camps, which are like daycare, as well as summer overnight camps. So that's one of those situations for overnight camps where it's really difficult to have an overnight camp in the middle of a pandemic. Some camps have chosen not to have sessions this summer. Others have continued, and we've put information out about what to do. If possible, it would be good for the children or the staff to quarantine themselves before they come to camp, and then if possible, if they can get tested, make sure as much as possible that they don't have the illness before they come to camp. That's much better than doing neither. But it is a difficult situation. I'm not sure if I had children in the camp age, I would send them to camp this summer. But many people do want to send their children to camp. There are camps in operation this summer, and so we've tried to provide information for them, directives about what they need to do and what we recommend to do for them to do, even if it's not required.
All right, I'm going to shift gears here. Ken Clark asking about any recommendation on lowering transmission rate in the office environment by using filters or UV-based air purifiers, etc., on top of the normal procedures, masks, social distancing, etc.
I haven't looked at the medical literature regarding UV for this particular situation, but I do know for other infectious diseases that UV-based lights have been helpful in reducing the transmission of infectious particles. The literature I'm most familiar with is tuberculosis, but tuberculosis and how it's spread differs for how the COVID virus that causes COVID-19 spreads. So tuberculosis bacteria get aerosolized, and they get in the air circulation and can move through the air ducts and and places, and they stay aloft in the air and don't fall out like a droplet. COVID-19 is more spread by droplets. When people speak, laugh, cough, sneeze, sing, they give off these droplets, and they fall out onto the surfaces nearby within a few feet, 4 or 5 feet. And if you're exercising and you're running, they can come behind you. So a runner behind you can pick up those droplets too. So that's a interesting phenomenon. But for an office environment, it's mostly going to be cleaning the surfaces, the commonly touched surfaces. And I'm seeing more literature that fomites, which is touching things, don't seem to play as big a role as the direct spread, getting in your mouth, nose, eyes, from people who have the virus. But so frequent cleaning of the environment is going to be important. Social distancing, it may be necessary for offices to rearrange their seating arrangements or their desk structures, or put up some barriers, or maybe more cubicles if it's been an open space, as well as staggering breaks or lunches or common areas where people come together. Frequent hand washing is important. This is kind of crazy when you think about it, but people should make it their goal to wash their hands 10 times a day. And it's nothing magic about 10, but it's the idea that you're constantly cleaning your hands on a regular basis. You clean them when you come into your office or when you go out of your office, when you change settings. So if people think about cleaning their hands 10 times a day and do it regularly and make it a goal, then they're more likely to achieve those kinds of practices or habits. I've taken off my rings because it makes it easier for me to clean my hands, and I tend to get, irritation under my rings with soap and stuff. So I've just quit wearing rings for the time being. And then, of course, in a setting in an office where you cannot maintain a 6-foot distance, people who work there need to be wearing cloth face coverings.
I can ask a real quick follow-up here. Any recommendations on cleaning soft furniture like couches?
I haven't seen that. It's not going to be as easily to for that to be transmissible on something like that, where if the droplet lands, it's going to be absorbed and it'll be dried very quickly, and the virus won't endure very long. The CDC has really good information on their website about how to clean. I haven't looked specifically for that, but I'm sure you can find some ideas about what the best thing is to do for cleaning soft things.
Dr. Jennifer Dillaha, the state epidemiologist, joining us this afternoon, fellow Rotarian. Sharice Jones-Branch asks, is it safe to do things like get pedicures and manicures?
It depends on where you go and whether they're following the guidances that the health department has put out. So wearing a face covering yourself and the other patrons, as well as the people who are providing the care. I have personally made a choice not to do that. And so what I do is I give myself a pedicure, and then I send a $35 check to some charity. So I'm spending the money still, but getting my and taking care of myself. But I have decided not to frequent places like that right now.
I have a 15-year-old daughter who's gotten pretty good at giving my wife a manicure. So.
Oh, that's pretty good.
Let's see, changing gears here a little bit. Brooke Ivy Jones asks, is it still recommended for groups to have fewer than 10 people? So
that guidance or directive from the governor is not in place now. For indoor and outdoor settings, social gatherings, it's 50 or fewer. However, if there's an event like a wedding or something like that, then and it's going to be at some venue, say a hotel or I don't know what place, Trapnell Hall or someplace, then a plan can be written out and can be emailed to the health department. We're having someone review them to make people think through what they need to do to have an event with more than 50 people. So right now it's up to 33% of the capacity of the venue, which could be, depending on the venue, could be a few hundred people. But we want organizations or places that are hosting such events to think about what needs to be done, and then making sure that they adhere to it. They agree to adhere to it by having a detailed plan.
Jonesboro Rotary Club President Brian Riga is asking, 2 weeks ago, Dr. Nate Smith referred to Craighead County as a, quote, hot spot. Was that due to increased testing? And how are we doing now?
We have noted that in Northeast Arkansas, we have had increased number of cases. And I would have to look at the data to know how we're doing right now. I know that part of the state has seen an increased number. Some of it has been work related in terms of some of the manufacturing or poultry related, but I would have to actually go and pull the data from that particular county to know where it stands now. And I'll be happy to do that if you want to send me an email, and I'll get the information back to you.
All right, John Deacon, also Rotary Club of Jonesboro. He's going to throw me a curveball here. Let me see if I can pronounce this. Has any hospital in Arkansas tried the preliminary drug? Is it remdesivir?
Remdesivir.
That's right. There you go.
So actually, yes. So Arkansas has received a number of doses, some hundreds of doses. I'm sorry, I don't remember the numbers off the top of my head. We've received 2 or 3 shipments, and it's the job of the health department to allocate those shipments to hospitals around the state. And we have done that based on the numbers of COVID patients that they have. And so this medication looks promising in terms of being an effective treatment, which we're happy about. So the supplies of the medication are still limited. And so we've had to provide some guidance to hospitals about how to allocate that medicine that they receive to their patients if there are more patients than medicine. So this medicine is given as an IV, and there's either a 5 or a 10-day course, depending on the status of the patient. But we are using it in Arkansas, and we expect to be able to have more as time goes on. That leads me to remark about other people are familiar with the drug that was hoped to be beneficial is hydroxychloroquine, and that has been showed not to benefit patients compared to patients who didn't get it. In fact, they even had a higher mortality rate. So that drug has not proven to be the hoped treatment that it was. There are other drugs now under investigation, or studies, I should say, going through clinical trials, and I'm hopeful that we'll have additional medications that will make a difference for people with COVID-19.
All right, last question. A lot of folks going to the lake this summer because we have great lakes, and that's what we do here. We're grateful to have them. Walk me through a situation where you're probably safe doing this, probably not safe doing that if you head to the lake.
All right. So I live on a lake, and it's just great to be able to be outside on the water with other people. I encourage people to not mix with other family groups or people that are strangers. It's great if you want to go to the lake and be with your family or other people that you're accustomed to being around. But to have groups mix is a risk. You have to recognize it as a risk. And social distancing in those settings is going to be important. So if there's a swim beach or a swimming pool at the lake, you want to watch it. But being outside is just a wonderful thing. Being with your family and avoiding unnecessary interaction with strangers or people from other places. You know, some people will be from out of state and with unknown exposures. So if you can kind of keep to yourselves, that's going to be safer than mixing at this point in time.
Great place to leave it. Dr. Jennifer Dillaha, fellow Rotarian and the state epidemiologist for Arkansas. Appreciate you as always for taking time to join us this afternoon.
Well, thank you very much. I'm really happy at this point in time to be a Rotarian because, I mean, Rotary rocks. So thank you.
Absolutely. Absolutely. And you do too. We appreciate you. And thank you everybody for tuning in and asking questions. It's very important. I know we'll continue to do these as more information comes out, and take a moment to like Rotary District 6150 on either Facebook or YouTube. And now I'll turn things back over to District Governor George Fray. George?
Yeah, on behalf of all of 6150, I would like to thank each one of you, Hatton for being the moderator, and Dr. Dillaha for this being our speaker today, and also for I want to thank a guy that really puts this together, and that's Sam Hummelstein, for all the work that Sam does. Great program, and I want to thank each one that was a part of it today, of our members that have chosen to listen. So that concludes our program for today. Thank you.